Good morning everyone, I am Dr. Vaishnavi, Department of General Surgery. Today we are here on behalf of Neurosurgery for the Spinal Cord Injury Day. 5th September is observed as a Spinal Cord Injury Day based on the recommendations of International Spinal Cord Society with an aim to create awareness among the general public for the spinal cord injuries and ensure greater success of preventing programs for the spinal injuries. Spinal cord usually have a descending tract and an ascending tracts. Descending tracts conveys the information from the brain to the various parts of the body like muscles of our limbs, heart, bladder and respiratory musculature. Ascending tracts transfers the information from the various parts of our body to the brain. In a spinal cord injury, usually these tracts will disrupt, which leads to arrhythmias, hypotension, inability to move the extremities, which may have consequences like physical, mental and social consequences. The most common cause of spinal cord injuries are the automobile crashes or falls, motorcycle accidents, gunshot wounds, medical or surgical complications. Road traffic accidents appears to be the most common cause of spinal cord injuries, which can be prevented with the usual safety measures like wearing seat belts while driving, avoiding alcohol intake while driving and not talking on mobile phones and following the adequate traffic rules. The current average age of injury is 42 years and 80% of the new cases are most commonly seen in males. The most common type of spinal cord injury is incomplete tetraplegia, whereas the least common is complete tetraplegia. A complete spinal cord injury means that there is no sensation below the site of injury. An incomplete spinal cord injury means that there is some retention of sensation in the affected areas of the body. Usually, we can divide the spinal cord injury into primary injury and secondary injury. Primary injury is a direct mechanical trauma that occurring at spinal cord and usually it's some form of impact with persistent compression. The spinal cord usually surrounded by the bones and those bones can fracture and break and fragments of those bones can impact the spinal cord directly and causes the mechanical trauma. Secondary injury is a phase that happening in minutes to hours after the initial spinal cord injury. It is usually due to the decreased blood supply to the cord. Depending on the location and severity of injury, the symptoms of spinal cord injury vary widely. The standard symptoms include pain and numbness, inability to move the extremities or walk, inability to feel the pressure, hot or cold, muscle spasms, loss of bowel or bladder control, and difficulty in breathing. Usually there are three regions in the spine: cervical, thoracic, and lumbar. Injury to each region is different. If the cervical region is damaged, it can be life-threatening. Damage to the cervical region affects arms, legs, mid-body and difficulty in breathing. Higher up the injury occurs, the worse the symptoms. Damage to the thoracic region usually affects legs, pelvic organs and can impact the blood pressure. Damage to the lumbar spine usually affects one or both legs and urinary incontinence. Paralysis of both arms and legs is called as tetraplegia, whereas paralysis of just the legs is called as paraplegia. Unfortunately, there is no cure for the spinal cord injury. Instead, medical professionals work at restoring what they can and helping the individual to adapt to their new way of life. Usually on the site where the spinal cord injury is incurred, the emergency personnel will immobilize the spine using a rigid neck collar and a rigid carrying board. After leaving the hospital, the patient must adapt to the new way of life with potential limitations in motor and sensory control. For this, they may seek the rehabilitation. This may include physical therapy to help strengthen the muscles, assistive devices which aids with communication, vocational therapy, occupational therapy and recreational therapy. This year's theme is reflecting on the past year, a year in which the world changed irrevocably due to the global pandemic as the spinal cord injury patients and their relatives have faced many mental health challenges and coped with the continued isolation the pandemic has controlled. Thank you.